Matthew Holt, another THCB Spotlight. And this time we're going to be diving into the world of patient experience and how the hell to measure it. All right. My guest is Paul Jaglowski. He is the CEO of Feedtrail. Paul, welcome to THCB.
Hey, Matthew. Pleasure to meet you. Thanks for having me on.
All right. Well, so looking forward to this. We're going to dive in a bit. So you'll start off. I mentioned you're in the world of patient experience and helping hospitals, providers, and others measure that. So tell me how you got started in this business.
Yeah, so my background prior to starting this company was actually in management consulting. So I was doing business process improvement, strategic planning, org change management for a variety of clients. And, I was traveling every week to client sites, and I kept getting a generic survey about my experience with the hotel I was staying at that Monday through Thursday, the day after I checked out, or I'd get a survey about the rental car experience the following week when I was sitting in a different rental car. And that was kind of the light bulb moment. I know it doesn't really tie to healthcare yet, but the light bulb moment of it's amazing how these massive organizations, these important companies learn from and engage with their customers. So that kind of opened my eyes to the reality of surveying. And then my family had an experience where, we were in the hospital for a little while, and candidly, it didn't feel like the most personalized care. Once we were discharged, we got a phone call survey a couple weeks later, and then a mailed survey with 30 plus generic questions that had nothing to do with the experience we had just had. And that really made me think, gosh, healthcare has such a long way to go from building patient trust, treating patients or their customers in a far more personalized way. Because as you can imagine, as you've experienced, is there any more intimate experience an individual has in their life that's aside from healthcare, right? Either it's dramatically scary if you're going into the ED unexpectedly, or you personally are the one injured, or it's beautiful, your loved one's having a child, which is also scary, but it's intense is the point. So we went down the path of saying, how do we improve and personalize the way these healthcare organizations are engaging with their patients and families in a more personalized way, in a more real-time manner, instead of waiting days or weeks to engage once that experience is over? And then how are you empowering those teams to do something with what they're learning from patients? So that's
Right.
a long-winded answer as to how
Yeah,
this.
well, I mean, so it's not like healthcare, as you mentioned, doesn't survey a lot already and trying to figure it out. We have, a huge company called Press Ganey, which is dominates the survey space. We have the CAPS surveys, which are used to incent and penalize hospitals. We have a bunch of other surveys around Medicare, Medicare plans and stars for them, and patient experience is measured each way. But I think you're right, not in a particularly helpful way. So what do you guys do that's a bit different?
Yeah, so we built a web-based or digital platform that integrates with an EHR. So rather than sending that 30 plus question HCAP survey post-discharge, we empower our clients to engage at key moments or milestones throughout that patient or family experience. It could literally be 10 minutes after they step foot in the door for the first time ever at a new hospital. It could be after meeting their admitting physician. It could be following a PCP appointment. But by integrating with the EHR, we send text message based primarily surveys to those patients or loved ones with hyper relevant and personalized questions tied to what they are going through at that point in their journey.
All right. So now let's take a look at what it actually looks like. Let's dive into it a bit.
Sure.
Give me a sense about what the experience might be like.
Keep in mind, everything I'm about to show you is a demo account. So this is not a live client account, but it's somewhat relevant or similar to how clients use us. Of course, it would be
Very
great.
good. I'm glad to see that you're observing HIPAA and not outing all of your patients and clients' information on this. But good to
It's
have one at the
tempting to
demo.
show some of the cool things our clients are doing, but this is an example as if this organization is a hypothetical outpatient group, maybe five or six clinics, different specialties, number of providers here. Now, when a patient is receiving this, it might be immediately following an appointment with their PCP provider for adult medicine, Dr. Miller. This would go to them via text message. They would open it up on their cell phone, and it would show a picture of the individual they just met with. So clearly personalizing it a bit more than just a generic survey. Everything is customizable here. Of course, we help our clients if they want a starting point or want to benchmark against others, but let's just walk through a few of the key questions an organization might ask, right? Were you able to get the appointment as soon as needed? If not, what specifically could have helped you be seen sooner, right? Is it about appointment availability? On nights and weekends, would you rather be seen during the hours of 9 to 5, but more options for appointments? Maybe it's an issue with appointment scheduling. Let's just do that for the sake of playing along. I waited 45 minutes on the phone to schedule an appointment, right? Perhaps not too dissatisfied, but it wasn't perfect. Doctor was awesome. Love Dr. Miller. Okay, and let's say I'm 9 out of 10 overall satisfied. It was nearly perfect, but there's a small hiccup with scheduling. But I do want to recognize my doctor, right? Dr. Miller is amazing, right? Let's just say she's always so patient with me and provides very thorough explanations. Perhaps this is something that a patient would say. So in this case, right, the patient is satisfied, but they did have an issue with scheduling. So perhaps they do want to be put in touch with somebody who can address whatever the issue was. I'm going to push send. You can see I've completed that in a matter of seconds, maybe a minute tops, but I gave some good details. Now, because I am a satisfied patient, for the sake of this demo, we have it set up to go to the public review page of that organization's choosing to have that patient share about that good experience they just had with their doctor. Again, remove all the hurdles, but if that patient is satisfied, make sure they know where you want them to share publicly. I also, if you see the top right corner of my screen, I just got an email notification. A little banner just popped up there. This is an example of what a hypothetical clinic manager might receive if a patient has a concern or if they say, I want a response to my feedback. You'll notice that there's no lag time at all. I don't have to wait a week to hear about how patient Paul Jaglowski had an issue with scheduling. I'm made aware of it immediately. Dr. Miller can also be made aware of this immediately because if you remember when I submit the survey, we gave her a shout out, right? We said she was awesome. She's very patient. So now with the click of a button, Dr. Miller can log into this and see, patient Paul Jaglowski was here for an appointment. He didn't have a perfect experience from scheduling, but that's not really my fault as a doctor because I was focused on delivering the care. However, he did give me 2 really amazing shout outs. These are things that providers unfortunately don't hear enough, but our platform can help automate the positive praise to the individuals who received it and also help notify the individual responsible for whatever the issue was, in this case, scheduling, of any opportunities for resolution or any less than perfect experiences. So I showed a lot there, but the main point being the real-time nature, the customized aspect, and the triage service recovery help solve a lot of the manual efforts that organizations are doing right now to understand, manage, and then track down and resolve patient concerns. And we are helping our clients streamline all of that, get very explicit guidance as to what could be better next time, while also reinforcing the positive experiences patients are having and ensuring their providers who, since the pandemic, have unfortunately experienced a lot of burnout, but ensuring they feel the love and feel the appreciation from those patients.
That's great. So you're both, I mean, I think the positive feedback is pretty unusual, right? Especially if people get it systematically and all the rest of it. So well, you're going to my next question, which is, okay, that's great. How do you figure out, that's for one individual patient, but how do you figure out how does it actually work in the workflow of the clinic, and how do they figure out the whole thing? So when you dive into this part, I think you'll hear.
This is just a high level view of the dashboard. Again, I keep saying customizable, configurable, but the reality is not every healthcare organization is the same, nor do they have the same interests or challenges or opportunities. So everything's customizable. Here's an example of a typical summary page or dashboard where these are some standard KPIs. You might want to see the volume of feedback coming in, top box score breakdown, net promoter score. By clicking this button, you can see what those key drivers are for promoters, and of course, text sentiment to understand what patients are saying in the comments. But at the highest level, you can easily adjust the date, the time range to see what your organization is doing and how they're performing overall. You can quickly see a high-level snapshot of the 5 or 6 clinics, how they're performing from an NPS lens, how individual departments are performing, and even individual providers. You can then click into any of them and see what patients are saying about those providers. But the example I just gave, right, one use case might be an organization really wants to understand when a patient is not being seen as soon as they'd like for an appointment, what are those recurring themes? What are those things they desire that they're not currently getting? you might have seen these earlier when I gave the demo, but you can quickly validate that, okay, patients don't care as much about approved appointment availability, but clearly they have issues with ease of scheduling. Clearly they have issues with transportation. So let's just click on ease of scheduling for the sake of demonstration. By clicking that, you can quickly see this is the one that I just submitted, right? I waited 45 minutes to schedule my appointment. Every time a patient has an issue with scheduling and provides more details regarding what the issue was, you can organize that and quickly validate, right? This patient waited 30 minutes. This one thinks scheduling is a nightmare. So clearly that's something you need to focus on to really drill deeper into it. And then at the provider specific level as well, let's just go to Dr. Jaglowski. He or she can see all of their scores, their own scorecard if they want in real time, instead of waiting the end of the year. They can also see all of the comments that patients are sharing and the praise that they are getting in real time, instead of assuming the patients are having a good experience or leaving a really busy day where they saw back-to-back patients for 8 or 9 hours. They can feel that love, feel that appreciation, and be reconnected to their why they got into healthcare in the first place.
So so let's start with the individual providers. So how do they normally get come in and get this when you work with your clients? How are they getting this information? How often are they looking at it? What kind of difference do you think it's making to them? And then on the flip side, if there's negative stuff about them, how do they feel about, how do you know how they're feeling about that, and how does it get handled within the organization?
Yeah, unfortunately, it's not handled in a standardized way currently, either good or bad, kudos sharing. So my wife is a nurse practitioner. I can tell you from her perspective, once a quarter, she sits down with leadership and says, here's your patient experience scores. Here's what patients are saying, good and bad. If something bad happens to come up, you better believe that their leadership is quicker to point that out and schedule an ad hoc meeting or send it to that provider in real time. But that's not, in our opinion, the way it should be. So often providers, when we meet with new clients and we're rolling out a new organization, unfortunately, they're coming from a culture where providers don't trust patient experience scores, don't place a ton of importance on them, because historically all they've had is a slap on their wrist if they weren't doing a great job. But the shift here is, once this is live, there's a few ways providers can get this. One, we often encourage our clients to give providers access so they can log into their specific page,
right,
and monitor this in real time. But at minimum, they can schedule reports to be sent to them weekly, monthly, or even daily with whatever details their leadership deems relevant.
Okay. And are you finding that for most of your clients, which of those options they tend to pick? Or is it all over the map?
I think these sending of reports on a weekly or monthly basis, the top performers really encourage them to log in, but they're busy. They should be focused on providing patient care. So make it easier for them to see what's going on. Fair
enough. And then on a sort of company-wide or clinic-wide basis, how is this being used to sort of, obviously you showed us the example of, there's a problem in this one clinic with phone-based appointments, clearly. Can you explain, how does that connect into the workflow and the sort of changes that they might want to make?
So a few things, starting one level higher, right? So these organizations are often starting here with a baseline question saying, all right, which of our clinics are scoring highest or lowest on the example I gave you earlier, appointment as soon as I need it, or even, let's just say, quality of care.
Yeah.
This allows them to say, all right, let's drill a bit deeper into East Millbrook and see what specifically is being said there to inform some minor improvement adjustments, or maybe it's related to an individual provider. Same thing with departments, same thing at the provider level. So that's one way that gives them a starting point, and then they can drill deeper as well. When you think about, one of the things we discussed is service recovery, the idea of being made aware of opportunities for improvement or resolution before it becomes a formal complaint or grievance or something that reaches the public kind of review pages. So our platform helps organizations quickly categorize what those recurring themes are when a patient says, I have an answer I need a response to, or simply gives a low score. So they can quickly identify any recurring themes and say, okay, it might be time for us to have a training around bedside manner or communication, because this is routinely coming up. Or if it's cleanliness, maybe this just is a light triggers notification to go to environmental services and say, all right, this is the specific area where we consistently get concerns. What's going on there? Do we need to have an additional team member added to that clinic? Do we need to have a more frequent cleaning of that specific bathroom or that room? So it just helps point them in the right direction.
Very good, very good. So, and then you mentioned integration with the EMR. So, where, I mean, obviously beyond the individual ADT feed, what other levels of integration is required to get this, and and how complicated is that for you when you come to a new customer?
Yeah, it's let's see. I showed this earlier, but very quickly. These are all the different standard identifiers that our platform encourages clients to collect. Now, this is not a real patient, but it's just a demo data, hence why some of these numbers are a little wonky.
Right.
But when we do that simple integration with the EHR, we need to understand, you mentioned the ADT feed, right? We want to understand when that patient was admitted, discharged, transferred, but we can also help really personalize engagement by race, by different demographics, by where a patient lives, by their history with the organization, by their payer. So if we simply get this information with that file transfer, we can help organizations really drill into these details, cut and slice the data, and understand that, a white female patient who lives in Idaho might have a different expectation when they first step foot in the door than a white male patient in Idaho, right? So how do we personalize engagement? How do you send them a different welcome message? Who do you need to send a navigation map the first time they arrive compared to who do you need to get a ride for to even get there in the first place? So this information from the EHR is really helpful for personalizing that outreach.
All right. So your contention, I assume, is that compared to the data they're already getting back from the typical surveys with the age caps and the other types of stuff they're doing, this is both more presentable to the frontline staff more quickly. It's more immediate. The data is certainly more accurate because it's not mail based and people are getting on their phone straight away. And then and it's more actionable for the organization.
Absolutely.
So go ahead.
Sorry. I'll say it's amazing. The simple concept of getting the team more data in real time, it might sound daunting to some people, but that's the beauty of these reports. We don't need to just send them a mass file and say, read every comment that just came in here, because we're getting millions of responses a month within our platform. But we help them distill it in easy to understand reports and point them in the right direction. So they don't have to make as many decisions. They can just see where their attention is needed and then deliver that attention or that support as necessary.
And then in terms of, I think there was a screen you flashed past in terms of potential savings and ROI. Do you quantify that as well for them in terms of how this works out?
Yeah, depending on the average cost of the patient value for a knee replacement versus a normal PCP appointment, we can have all of that added into the platform as well. So you can really understand the value of the patients you're recovering who are at risk of going elsewhere for care.
All right, excellent. Anything else to show us, or should we just switch the demo?
Yeah, we can. One last thing I might show you, because this is pretty interesting. When we think about hyper personalizing engagement, this is just one other example of a survey that many clients of ours are using. But this is an inpatient example. I showed you the outpatient, but example of engaging following a surgery and how it's different from an unplanned ED visit or some other PCP appointment. In this case, hey, we know you likely have a lot on your mind. We want to make sure we understand the perception of your care. How would you rate the overall experience? If it's 5 out of 5, wonderful. We're glad it's going well. Anything you want to highlight for us to be aware of that we can replicate next time? If it's not perfect, hey, we're happy it's going well, but it looks like we could still do better. Again, just that minor adjustment of personalizing the tone with which they're delivering and engaging makes you feel like they actually care, and it's not just a robot asking you questions or on a recorded line. But in this detail right here, what specifically can we do better to improve your surgical experience the remainder of your stay? This is where care teams can use this data on a minute-to-minute or hour-to-hour basis and say, Paul in room 201, who just had a knee replacement, has a question about what's going to happen between now and when he's discharged. Next time somebody walks in there, please be prepared to explain the follow-up plan. Right. Or if Paul has an issue with understanding recovery after he or she leaves, they will know the next time they walk in what Paul wants to discuss, so it can be very personalized to him, and you're not wasting time just checking in on a normal round.
No,
So this
that's
is a
very helpful. And so are you finding that you have inpatient or sort of services where there's an ongoing, plan of, there's an ongoing procedure or hospital stay or what have you, where this is actually getting used and where people are
absolutely.
getting sort of,
And from my personal experience, my son just happened to be in the NICU for 101 days.
right.
We got a phone call survey 2 weeks after he was discharged about childbirth. So
Oh, God.
115 days ago. And that's what they're asking my wife about.
Right.
Many of our clients, especially these peds hospitals where they have really good NICU programs, they're engaging 48 hours after the family or the child has been admitted, asking basic, hey, we know you didn't plan to be here. What can we do to make you feel more supported? A week later, they're asking different questions because ideally by then you've got your bearings, you understand how to navigate the NICU in the hospital, et cetera. And that's a really, really great way to build that trust and involve families and patients in that care journey instead of just delivering the same repeatable experience to everybody.
That's fantastic. That makes a lot of sense. And then this comes back to the patient, to the organization, the doctor in a similar way.
Yeah, this might go to the charge nurse in this
Yep.
specific department or whoever is monitoring it. That's right.
Fantastic. All right. Well, let's end the demo there, Paul. That's fantastic. So let's talk a bit about. So you've built this really cool tool. I mean, obviously coming from your experience there, in the NICU and a bunch of other experiences that people have had.
Sure.
I like the concept of immediate, feedback that's useful and helpful. That can actually change people's behavior and make sense rather than, have to deal with something weeks after the fact that a not very specific patient question. What are you finding is the sort of level of uptake by patients for the places where you've actually introduced this?
Yeah, so generally speaking, healthcare surveys, they get less than 5% response rates, especially the HCAP surveys. It's far less at times. With us, we expect over 25 to 30% response rates. We have some clients and some care settings that get over 50% response rates. We know it's never going to be 100%. That's just not realistic to assume. But because if I were to ask you, do you have a cell phone nearby? Everybody has a cell phone within arm's reach at all times. That's just reality of life today. So engaging via text message at an appropriate time, right? Not while they're asleep, not 10 minutes after they've entered the ED, but in relevant time with relevant questions in a format that they are comfortable engaging, we get much, much higher response rates than others.
That's great. So tell me a bit about the company. How long you've been doing this? How many clients and what flavor clients do you have?
Yeah, we started back in 2016. We have clients in over 40 countries already, hundreds of organizations in the US, and we work with really all types of healthcare organizations. We work with the big national brands that everybody would recognize. We also work with very small, federally qualified health centers or community hospitals. We also work with physician practices, physician groups, specialty clinics, surgery centers, really you name it within healthcare, labs. We support them. And as you can imagine, all of them have very different patient journeys or patient experiences and resources to support these projects. So it's been really fun for us to get exposure to all of them and figure out these kind of personalized engagement pathways and journey map with them to improve that patient loyalty.
All right. So I saw on the wire a little bit about sort of revenue and where you guys are as a business. So give me a flavor for what you've disclosed to the world so far, both on the revenue side. Sort of give me a sense of the number of these large clients, and give me a sense of how much funding you raised.
Yeah, we're proud to say we've been pretty cash efficient. We've only raised $3 million over the last couple of years, and we've been profitable for several years as well. I don't want to overshare regarding some of those details, but we're at a point where we might never need to raise money again, which is comforting.
Give me a sense about how much putting something like this in costs compared to what they're paying Press Ganey at the moment. I'm sure they're still paying Press Ganey, right?
For the inpatient hospitals, we certainly supplement someone like a Press Ganey, one of the other CAPS vendors. We do have partners who deliver CAPS surveys now, which is a new offering for us as an organization. But let's imagine a community health center with 4 doctors and 10 or 15 employees. They might be paying somewhere between $10,000 and $20,000 a year for this, whereas a large health system is easily in the six figures for this. So the range of clients really influences that price point.
All right, fantastic. What do you think? So you just mentioned, adding HCAPS as a partnership to this. What do you think? I mean, is the next few years for you just growing, stepping and repeating, growing this in more and more scenarios? How much more different development, different questions, or different types of things are there for a customization? Is there for different flavors of organization, or is it really sort of stamping and repeating what you've got now?
For the sake of this demo, we kept it pretty streamlined. We showed the surveying and a little bit of the reputation management piece. The thing that's been probably the most humbling for me and the founding team is we really got the trust of our clients early. And by doing so, they ask us, hey, can you also solve this problem? Can you help us with this? Can you help us get patients back in the door after they don't show up for an appointment? Can you help us by delivering a rounding solution because we don't like our current vendor? Hey, can you help us replace our reputation management vendor, please? So we've added modules across the platform, and we are certainly now more of a patient engagement or patient experience platform instead of just surveys. So of course, it's easy to say you can keep adding modules, maybe a complaints and grievances tool, maybe it's something to help with scheduling. But the reality is, our solution right now, there's so much opportunity within the market to help organizations either go from a manual effort of doing this paper and pen or phone call surveying and digitalizing and automating a lot of it, or enhancing and supplementing the post-discharge CAP surveys, because as you can imagine, pick any hospital, the ED experience is night and day compared to L&D experience, compared to ICU, compared to NICU. So there's so many gaps and white spaces within that healthcare journey that they need way more visibility into, and there's a hunger for it within the industry, that even if we didn't keep adding modules, there's just so much potential within the market and across the different verticals in healthcare that we still are very optimistic that growth is going to continue as planned, as is. That said, that leads to, you think about the product innovation lens. We have been working really hard this year on a new XM Insights platform, so a far more advanced analytics per se. It's one thing to help capture surveys, organize those insights, and point organizations in the direction of having an impact or seeing an improvement. But this new solution, which is in beta right now, is going to be a far more robust analytics platform, really powered by Microsoft BI, to help organizations really understand detailed trends, detailed correlations within their patient experiences and their organization as a whole, right? Where exactly do you have problems? Organized by theme, by category, by location, by frequency, and where should you invest for the biggest impact? How are different demographics of patients experiencing different touch points within your organization, and helping organizations visualize how those compare and what they should do differently next time, and how to truly delight every patient who steps through the door, not just deliver a satisfactory experience. So we're very excited about going deeper into the analytics as well.
Yeah, no, I mean, as a general comment, as somebody who's had a reasonable amount of experience with the healthcare system, the concept that it's, trying to be customer friendly or delighting the customer is something that I would say is pretty foreign to many healthcare organizations. Not like you specifically UCSF, but you do. But,
it's true.
Trying to figure out how to access a doctor and access an appointment and, all that stuff. And in general, healthcare systems are busy and often don't have to care. But it's great to see that someone like a Feedtrail is bringing tools to organizations that could, not only track what's going on, but also help them figure out how to improve that experience. Because at some point, that patient experience matters, and it not only matters for just the business of patient experience, but happier patients lead to happier staff, and they all leads to better outcomes, right? We know those three things all go together. And it's really remarkable how little healthcare is, given the amount of money forked over, both direct, from insurers, but also direct out of pocket. It's remarkable how little healthcare is focused on that. But I think with the HCAPs, the Medicare stars, whatever, the stuff is starting to be noticed.
It is. Healthcare has historically they've innovated around the delivery of healthcare, but they're now being forced to innovate around the experience of healthcare, right? Because patients have more choices.
No, I've always used to say at Health 2.0 that our job was to help the entire Health 2.0 community, improve the patient experience. And, I think you're measuring and explaining and allowing people to tweet that is a big part of it. So you're certainly right in the bullseye of that. That's fantastic. All right. Well, I've been speaking with Paul Jaglowski. He is the CEO of Feedtrail, which, as we said, has now gone from a patient survey company to being a wider patient experience company. But he showed us really how that sort of right up to date, just in time surveying tool really helps healthcare organizations. And congrats on the progress so far, Paul. Thanks for your time.
Thanks for having me, Matthew. Take care.